Hi, so welcome to a new topic, and this is a short and sweet topic about drugs for urinary tract infections, or in the short form, we call it as UTIs. Now, first, let's do what are the types of UTIs that we actually need to look into, and then different drugs which are going to be active against the UTI. See, almost the antimicrobials which I'll be talking about are already covered in different chapters, and only a few specific urinary antiseptics I'll be talking about in this chapter. So types of UTI, they can be it can be actually acute UTI, suddenly it has happened, or it can be a chronic UTI. Then acute UTI, it can be a problem in the lower part of the urinary tract infection, so we call it as lower UTI, or we can call it as the upper UTI. So see here, if we talk, this is a structure here of the kidneys, the bladder. Now bladder and the urethra part, if these are infected, cystitis and urethritis that we call, then we label it as a lower UTI. Now, lower UTIs are relatively very easy to treat. You just require therapy for short time, around 3-5 days, and it can be corrected. But in case we don't, actually manage them well, or we overlook them, then the same infection is going to go in the upper direction. It will involve the ureter as well as the kidneys. And when it involves the kidneys, it is called as pyelonephritis. So when that occurs, it becomes more of a systemic infection, and this is called as the upper UTI. Now, these upper UTIs are relatively more difficult to treat, right? And they would require, a prolonged antimicrobial therapy. That's the problem. And then they can progress into various other infections, systemic infections, like renal hypertension, all those kinds of diseases can occur because of that. So it's so imperative that, whenever the first chance you find UTI is there in the lower urinary tract, we should treat it there and then. So this is the differentiating, the mark between the lower and the upper UTI. So whenever acute UTI, it is not treated, untreated, that actually progresses into a chronic UTI. So it will, it is there for a long period of time and it is recurring. So that is a chronic UTI. And mostly, obviously, when it is there and chronic and recurring, they actually usually is a disease underlying it, which is definitely going to cause chronic UTIs, and you have to treat that particular disease because of that. So slightly they are much difficult to treat as compared to acute UTIs. Right, let's go to the drug therapy now straight away. Now, how to manage them? We can manage them by 3 ways. Either you give a urinary antiseptic, we have some urinary analgesic, and we have antimicrobials that we've done. Urinary antiseptic, what are now the urinary antiseptics? So these are called as urinary antiseptic. Why? Because they attain antibacterial concentration. So they attain these antibacterial concentration in urine only, nowhere else, not in systemic area, only in the urine. So when you give them, they go into the urine and they attain their antibacterial concentration. That's the major thing. And they are more effective, they are more useful, or they are more useful in lower UTIs. Upper UTIs ke liye, we would require let's say a broad spectrum antibiotics, antimicrobials, not urinary antiseptic akela won't be effective in that. So more useful in the lower UTI. So their action is predominant in the lower urinary tract infections. Now, the 3 drugs which fall under urinary antiseptics are, the first is nalidixic acid. Then we have nitrofurantoin. And then we have methenamine. These are the 3 urinary antiseptics. Nalidixic acid we've already covered in the chapter of quinolones, right? So they are bactericidal, right? So they are in one of the quinolones, and because nalidixic acid is not used for any other systemic infection because वो वहाँ पे कहीं पे भी doesn't attain antibacterial concentration in the blood. That's why it is useless as a systemic antimicrobial. It's only used for UTIs because it is concentration to antibacterial achieve करता. That's only in the urine. So yes, when you're going to give it to the patients, you be careful about the G6PD deficient patients because there it can cause hemolysis. So that is the nalodixic acid. Now nitrofurantoin is a bacteriostatic agent, right? That's its main role here. And it is used actually it is actually preferred in case of prophylaxis, in chronic UTIs or prophylaxis. वहाँ पे हम prefer करते हैं. It is not very good drug actually for the acute urinary tract infection. That's the thing with this. And also because it is a bacteriostatic agent and nalidixic acid is a bactericidal agent. So in दोनों का combination is not advisable because they are going to antagonize each other's effect. Also, nitrofurantoin should not be given in case of renal failure. When there is a renal failure, not given. Okay? So, if there is an issue with the kidneys, there's a damage to the kidneys or anything, then nitrofurantoin should not be given. So, moving on to methenamine. Now, methenamine, what happens in the urine? There's a low pH, so about 4.3 का pH होता है. वहाँ पे it gets converted into formaldehyde. So it's a prodrug. It gets converted into formaldehyde in the urine, and therefore it this antibacterial action therefore results, and they are good if against the gram-negative bacteria, right? Then about them, the good thing about this drug is that bacteria don't develop resistance to it. So there is no resistance yet to this particular drug. But this is contraindicated in either renal failure or the hepatic failure. दोनों areas में इसको because it is a toxic metabolite and it can enhance the renal toxicity. So therefore, we should not give it in them. And in hepatic failure patients also because they are not able to detoxify the ammonia which will be formed because of them. So that's what the reason, not in hepatic, not in renal failure. So urinary antiseptics are actually given in mild cases and chronic cases, not in very severe cases. So preferably this is one of the most common urinary antiseptics given, nitrofurantoin. Coming to the urinary analgesic, which is phenazopyridine. It's a pyridine and phenazo, it's a dye, it's an azo dye. So it will stain the urine, it will color the urine of the patient in some orange and all. And so patient should not be alarmed because of that. Then only this is analgesic, matlab it will relieve the those irritating features like painful sensation, dysuria, those kinds of signs and symptoms will relieve. It's like an analgesic. So only it causes the symptomatic relief. Symptomatic relief of the pain, sensation, okay? Dysuria, etc. That's all. Not any other, has no other role. Coming to the important part, which is the antimicrobials used for this. जो antimicrobials use करते हैं, almost they are interchangeable. Almost. Some are not but some are interchangeable. That means you will use the same drugs whether it is acute or chronic, but the duration of therapy would be different. Well, some are totally different. They're only reserved for very serious infections or other things. So let's go to them. First is we have to see whether it is an acute UTI or a chronic UTI, or you're giving a prophylaxis to prevent further attacks. Okay? So acute UTI, again you have to see whether it's a lower tract infection or an upper tract infection. I told you lower tract infection are easier to treat. Duration therapy would be for smaller time, and आपको बहुत सारी you won't have to use really very those broad spectrum and all those kinds of drugs, and you can give them oral route, simple. Upper If it involves the upper tract, then you have to again see if it's a mild disease or it's very severe disease, and then your treatment therapy would be according to that. So coming to the acute lower UTI. Now acute lower UTI, let's say, and this is uncomplicated, मतलब bladder inflammation hai, but not that much. So it is not a very complicated case. So what all drugs, whatever you're giving, so duration it is usually for 3 to 5 days you give. And this is by per oral. Orally tablets हम दे सकते हैं. So you can give cotrimoxazole. You know, it's a combination of sulfamethoxazole and trimethoprim. You can give 2 tablets twice a day. Then you can give, I told you, nitrofurantoin, good for lower UTI and uncomplicated. Nitrofurantoin. You can give 100 milligrams tablet, again you can give it twice a day, and because it's an antiseptic, not an antimicrobial, you might need it for a week, right? Then you can give ampicillin. So ampicillin can be given 250 to 500 milligrams QID 4 times a day. So these drugs you can try for acute lower UTI. But yes, if it is recurrent, you know, such kind of thing, there is still recurrence and it is not treated, it again comes back after 2 weeks. So in that case, you give these drugs, and there are certain other drugs to be given, but continue for 4 to 6 weeks. If recurrence, then you need 4 to 6 weeks treatment. Okay? So you can keep this cotrimoxazole as such. You can give these, of course, the same dose for a prolonged period of time. Instead of ampicillin, you can give combination of amoxicillin and clavulanic acid together. It's a combination of 625 milligrams thrice daily, right? Or you can give norfloxacin, a fluoroquinolone. We can give 400 milligrams BD, or even give ciprofloxacin. आप वो भी दे सकते हो, ठीक है? Or you can give a cephalosporin, cefpodoxime. ठीक है? Give again 200 milligrams daily. So you can give all these drugs. There are so many drugs available. You can choose any of them according to the patient's condition and give them for about 1 month to 1.5 months. That's what you're supposed to be now. This is for the lower UTI. Now what happens if it is an upper UTI? It's gone into the kidneys, you know, pyelonephritis. Now it can be a mild infection. अभी बहुत ज़्यादा serious नहीं है patient. And again for this, you can give drugs by per or oral route, and here you might have to give for about 2 or 3 weeks, for 2 to 3 weeks. And what drugs can you give here? Again, we can try drugs like ciprofloxacin. You can even give norfloxacin, 500 milligrams twice daily. That you can give definitely. You can give cotrimoxazole, yes, again in the same dose as discussed above. Then you can give amoxicillin and clavulanic acid combination in the same dose, and again you can give cefpodoxime. So almost same drugs as you would give in a recurrent acute one in the mild case. But if it is a severely ill patient has severe complications, also your route would change to IV route. So give drugs which can be given by IV route. So you need to give now those fluoroquinolones, like you can give ciprofloxacin or norfloxacin, but you need to give by some parenteral. Then you give IV beta-lactam piperacillin with a beta-lactam inhibitor, tazobactam combination. You can give this. Then you can give ceftriaxone, ठीक है? Ceftriaxone by IV route, 1 gram. You can try these. You can even give carbapenems like meropenem. So all the higher order antibiotics are given, which have a broader spectrum, and you know they can tackle even the resistant ones, and they have to be definitely by IV. Now chronic UTI, why is this become chronic in that patient? So maybe there is a cause, so you have to treat the underlying cause. Until unless there is no treatment of the underlying cause, the infection UTI would continue to occur again and again. So definitely they are difficult to treat. The drugs would be the same, difficult to treat. Now you cannot give antimicrobials, throughout his life because he's developing, because there are problems in that, right? So basically you give treatment during its acute, जब acute episode हो जाता है उसको, ठीक है, otherwise mild है UTI चलने दो उसको. During the acute episode only you have to treat. Don't give otherwise as such. And in case of renal failure, in case there is a renal problem, you should avoid tetracycline. Avoid tetracyclines except doxycycline. That is safe in renal disease. Doxycycline. Except you can give doxycycline, but not any tetracycline. Also, you have to decrease the dose of other drugs which can cause nephrotoxicity, like aminoglycosides and their various cephalosporins. Okay, cephalosporins, and you should avoid them, or you should decrease the dose of these drugs. Now, prophylaxis. Prophylaxis is when you want to avoid any further attacks, and when should you give? When something you're doing and that is bound to cause effect of episode of UTI. For example, patient is catheterized. Catheterized patient. So patient is catheterized. Therefore, if patient is catheterized, because it's a foreign substance in the body, patient is bound to have this, especially with a diabetic patient, more chances of causing urinary tract infections. Sometimes there are some congenital anomalies. Congenital anomalies of the urinary tract. So that can lead to UTIs. Any obstruction, sometimes there is stone, okay, and that leads to stasis of urine and that leads to infection. So you need to give antibiotics for prophylaxis. Or if patient has a prostate enlargement, okay, prostate enlargement hai, and it is inoperable, it is not treatable. So there you can give such drugs, inoperable prostate enlargement, because they will press upon the urine, lead to obstruction, and they will lead to urinary tract infection. So that can lead to this. So all these are the reasons why we would like to give prophylaxis. And the reason is, or what do you want to give in prophylaxis? Remember that what can you give for prophylaxis? So remember your favorite cotrimoxazole. It's a favorite for UTI. Cotrimoxazole, simple. Then you give ampicillin. Dose has already been discussed. Same dose. Nitrofurantoin. So remember that we are suspecting that this can lead to a UTI. So obviously it will start from the low urinary tract. It won't go straight away up. It's on the serious case. So give those UTIs which can easily treat the lower infections, because higher infections usually tab hote hain when you are not able to treat them, and then they're going to be higher order. So what drugs can treat, can be used for prophylaxis? So remember the can treatment, right? So with this is actually about the UTIs. So let's just revise what we did it in today's lecture. What you should know about them. You should know that the management depends upon whether it's a lower or a higher tract. Okay? So whether it is a lower UTI, it's an upper UTI, or it's an acute or it's a chronic. Treatment depends upon that. Drug therapy, antiseptics this is the most important, is nitrofurantoin. It is used, and it can be used for prophylaxis, and mostly actually it is used for prophylaxis. You can give 100 milligrams twice a daily, or even at bedtime if it is not very serious, right? That kind of, you start with the 100 milligram PD, then gradually you can go to bedtime and decrease the dose to 50 milligrams. So It's a static drug, remember, and it is not to be combined with nalidixic acid. That's a very important point because they will antagonize each other's effect. Okay? That's a most important antiseptic. बाकी methenamine भी है, but we usually use nitrofurantoin. Analgesics are not much used, but just to know that there are such drugs such as phenazopyridine only to take care of the sign and symptom. Now, more importantly, we have the antimicrobials. Again, depends on acute hai, lower, upper, chronic, whatever. If it's an acute UTI lower may and it is not very complicated, so again you can remember the CAN drugs. So same drugs for prophylaxis, same drugs for lower urinary tract, uncomplicated. But agar recurrence hai, you can keep cotrimoxazole here, but the rest you can go further up. You can go to a higher order. Norflox, cephalosporin, and augmentin, which you call it. Amoxicillin, clavulicin, augmentin, right? Upper acute UTI, अगर mild है, again you can give because upper है तो nitrofurantoin is no longer a choice here. It doesn't take care of the upper urinary tract, but you can stick to cotrimoxazole, ciprofloxacin, augmentin, and ciprodoxim. So you can actually omit the cotrimoxazole and the rest you can keep the same of the previous one. ठीक है, recurrence वाले का. Severely ill, आप high orders दोगे and you give the IV. You can give the fluoroquinolones by IV. You can give the cephalosporin by IV, carbapenem, piperacillin, tazobactam. So basically, these are lactams here come into picture. Chronic UTI, need to treat the underlying cause. That's the most important thing here. And it's a damage to the renal failure. C, avoid all the drugs that are toxic to the kidneys or decrease the dose. Prophylaxis के लिए we use CAN. What can we use? Cotrimoxazole, ampicillin, nitrofurantoin. Remember the same ones used in the upper lower acute UTI, which is uncomplicated. Same therapy हम use करते हैं. Or prophylaxis means that you know that whatever something is going to lead to UTIs, right? If you're catheterizing a patient, the patient has a chance of developing a UTI. A patient has an obstruction somewhere in the urinary tract, there is a chance of developing UTI. Prostate is pressing on the urethroid, there is a chance of creating UTI. Congenital anomaly hai, the tract ठीक नहीं है, distracted hai, or whatever the reason is that there is a chance of stasis. Yeah, so that will lead to a UTI. So there you would like to give prophylactic antimicrobial therapy. So with this we come to the end of the chapter on urinary urinary infection, drugs against the urinary tract infections. So, antiseptics, analgesics, antimicrobials. That is what we need to know about that. So, take care, study hard. See you in the next lecture. Thank you so much.